Chief. In 1998, it looked like the federal government Congress was going to pass legislation kind of directing how the states were going to have to use their tobacco settlement money. And Oklahoma passed legislation and sent to the governor a bill to create a trust for the monies that would come into Oklahoma. The governor vetoed it at that time, and I've never been so glad for a veto of my bill in my entire life, because it allowed us 2 years later to draft legislation and create the structure that led to the tobacco trust. Oklahoma is unique in that we have a trust that is saved and protected by the voters of the state of Oklahoma. And now we started at 50% of that money went into trust, and 50% was available in a revolving fund so that we could initiate programs at that time, knowing that Oklahoma consistently ranked so poorly on the state of the state's health. Now, as we all know, 75% now of our money that comes from our tobacco payment go into the trust, and 25% still goes into that revolving fund, so that the legislature has the ability to use those dollars today to help promote good health and deal with the issues that continue to make Oklahoma struggle to have good, healthy standards. We, amazingly enough, we are a test state for so many fast foods because of the percentage of dollars that are spent in Oklahoma in fast foods. And yet, because of pressure from the public, pressure from people like you in this room, McDonald's has changed the marketing for their milk. You no longer get those little square boxes that we got while we were in grade school. You get, you know, the Hamburglar and Ronald McDonald, the cute, colorful bottles that kids are more likely to choose. You can now also choose fruit options instead of French fries. Pressure from the public can go a great deal in saying, if this is what our customers demand, then we will begin to supply, and we are seeing that in restaurants all across America. Today, we received a press release that the legislature passed, and Friday the governor will sign a bill that will provide incentives to those restaurants that chose to create a smoking room, so that we can have assistance for those businesses to eliminate those smoking rooms if they choose, so that more of our restaurants, more of our eating establishments will be smoke-free. We know that secondhand smoke is a problem and does cause diseases, not just cancer, but aggravates other illnesses that exist in our Oklahoma people, and we need to do all we can to try to reduce that. But what I get excited about are the opportunities for us to really reach in and do some immediate things to help our children. I have friends who have visited and been part of clinics in other states that are pediatric clinics that deal with diabetes. Diabetes stretches across all economic and ethnic backgrounds. But the opportunities that some of these clinics provide to bring the entire family in, so that you are not just dealing with the child who may have a need for insulin, but you are helping the entire family learn how they can change their behavior so they can be a help to the child and at the same time improve the health of that family. Moms are critical to this. We know that moms have, if you can change the opinion of the mother, if you can help her deal with how food is provided to her children, you are going to change the life of that family. I think all of these are parts that I can play as governor in helping lead the state of Oklahoma, so that we can finally have a report card on the state of the state's health that does not rank us at the bottom on every level.